What are signs and symptoms that your baby needs adjusted? Hey, it's Dr. Watt from Pinecrest Chiropractic. Let's talk about infant care. These are symptoms that you can oftentimes see right after birth or within the first month or so of your baby being born. So a couple of symptoms that show, hey, your baby probably has a subluxation and would benefit well from an adjustment. The first one that we see a lot is being colicky and or constipated. Those two things are usually overlapped. Now, a baby that is colicky just means they're really fussy and grumpy and you can't figure out why. Oftentimes it's because they're constipated. I'd be pretty grumpy then too, right? And so when we see those babies, we adjust them and can help their nervous system integrate better and help those bowel movements move along. The other things that you may see are a side preference when breastfeeding, where baby has a restriction moving one way, but moves just fine the other direction. And oftentimes that'll pop up with mama noticing that of, hey, why won't the kiddo feed well on this side, but does great on the other one? So those are two big symptoms that we see a lot. The third is a lot of spitting up or a lot of reflux. All three of those things mean that there's probably a breakdown in that region of the spine. The rotation and the side preference, that has to do with a subluxation in their neck. Middle back is where we're going to see some of that acid reflux type stuff. And then that lumbar spine is where we're going to find those constipation or colicky. One of my first pediatric patients specifically that came in was one of my favorite stories still to share, where this kiddo came in and mama was just in desperation mode of, my kid won't poop and I don't know what to do with him. I'm going crazy, he's growing crazy. This is affecting our entire household. So what'd she do? She handed me the baby, said, here, fix him. And so we went through and we found a spot in his lumbar spine that was subluxated. It was tight. It was really tender to the touch. You could see him wiggle every time I touched it. In fact, it actually felt a little warmer right around that vertebra. So we used a pediatric adjustment where we do a contact and a hold. I put my thumb on the side of that spinous process and held it, and just held it nice and gently until we felt those tissues relax. Don't push harder than I'd push on my own eyeball. So very gentle. And all of a sudden that low back started to release. And by the time I handed baby back, it was one of the worst smelling things I've ever smelled in my entire life. But that kid now had proper nervous system function, which meaning the rest of his body functioned better. We talked in some of our other videos about how and why these subluxations work, and so we can dig into some of those. But these things can make or break not only how your kid is functioning and feeling, but how the rest of the house is functioning as well. So if you want to talk more about what's going on with your kiddo and how we could make some changes in some of that, come on in, let's chat about it.